All right, we're all set. So you can see to the other side that I have Dr. EricNepute with me today. And I'm sure that a lot of you have seen his face before, and I am so honored that he has agreed to come in and do this little educational webinar with us. And even though I say little, it's going to be big for you, because what we are going to cover today is going to help tons of people. So if you are one of those people, or one of those millions of people out there, because I know it's about 80% that will have at least one issue with their gut, then this educational webinar is for you today. This live is for you specifically. So those that know me know that I have to just quickly say a brief disclaimer just to keep us all safe and you know, keep the Facebook world happy with us, right? So let's get this over with. So this presentation may contain general information about various medical conditions and their treatment. It does not provide medical advice, although we do have a physician with us today. The information provided through this presentation is for informational purposes only. The purpose of this message is to promote an understanding and knowledge of various health topics. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Before beginning any type of natural, integrative, or conventional treatment regimen that is being presented herein, it is always advisable to seek a licensed healthcare professional. But you actually have 2 licensed healthcare professionals online with you today. So you're very fortunate. And this is free information. So let me talk a little bit about Dr. Eric. I can tell you that Dr. Eric grew up on a farm, and at a very young age, and he was very athletic and into sports, and he had an injury, and I believe it was football, if I remember right, and that led him into the area of chiropractic, which to me, chiropractic is also in the wellness industry, right? And so he has gone on from there, and I just want you to know that this is Dr. Nepute's bio, and it is amazing. Like I was just so impressed when I got it. So basically, he's an author, he's a speaker, he is a licensed doctor of chiropractic, a certified doctor of natural medicine, a certified nutritional specialist, and certified internal health specialist. He has advanced training and fellowships and certifications in functional neurology, orthomolecular nutrition, internal health, as well as advanced biomechanics. So, and lots more. But I just want you to know, he is such just a person. He is a wonderful person who has a vision to help as many people as possible. And that's my vision and Dr. Tom's vision. So collectively, this information that you're going to get today is coming from a place of love. So I'm going to get started. And is it okay if we call you Dr. Eric during
That's perfect. Yes. And thank you for that wonderful introduction. I hope I live up to it. So I'm excited to be here with you.
I'm sure you're going to, because I've had conversations with you and you definitely live up to your reputation. So basically, a lot of people, I mean, I've been working in this field too for about 20 plus years since I went to school for natural healthcare. I'm a preventative healthcare practitioner and run a wellness clinic for many years, on and off, but tons and tons of people seen. And one of the biggest problems that I noticed in my industry was that we had a lot of people coming in that were complaining of tummy complaints, bowel complaints, disorders, and a wide range of problems. It always came down to one thing, in my opinion, but trying to find something that actually corrects and balances that was near impossible. And so the more that you learn, the better it is for you. So Dr. Eric, what do you believe is the root cause of all these problems? How do people get themselves into this situation?
Well, Lynn, I mean, here's the reality: stress, right? I mean, stress is the killer of all men and women on the planet. Except for when I say the word stress, you know, something comes to your mind. Everybody that's watching right now, you know, live now or watching it later, you know, and all your friends and family, they need to hear this stuff, because stress is what kills us. But see, stress is more than just emotional stress, right? It's more than just, my spouse, my kids, my job, it's there's an emotional component, but there's also a physical component to stress, and there's also a chemical component to stress. And so, I always say it's the triad of health, right? You have to have a balance in physical, chemical, and emotional well-being. So because of our lifestyle, because of the stress put upon us, because of the stress that we allow to be put on us, because of 2020 and moving forward, stress from that as well. And then the standard, like, how about the standard American diet or the Western diet and the drugs we take? All these stresses cause imbalances. And even Hippocrates, the father of medicine, says all diseases start in the gut. Fix the gut and everything else will follow suit. He was so right, it's not even funny. He also said, let thy food be thy medicine and thy medicine be thy food. And I think we've forgotten those two phrases that the founder of medicine really talked about. And Lynn, when you get into it and you start looking at the underlying causes that people have, the stress in their life, the chemical imbalances, the nutritional deficiencies, the emotional stresses, physical stresses, all those combined cause us to get out of balance. And I always talk about health. We hear the term ease, right? The term that person's body is at a state of ease. Well, ease is the Greek word for balance. Well, when we get in ease, it's like a teeter-totty, right? When we're out of balance, we get into dis-ease and then ultimately disease. So if we want to get those tummy troubles you were talking about, and by the way, most people have issues like upset stomach, constipation, diarrhea, reflux, and they just think that it's normal. It's their normal lifestyle because everybody else they know has it. Well, just because it's common doesn't mean it's normal. So I would say that to answer your question, that stress really is the root cause of those imbalances. And stress affects two systems in the body first and foremost. Number one, it affects your nervous system. We've all heard people say, I'm so stressed, my nerves are shot, right? Everybody knows that. Yeah. That's the first thing that gets affected. But the second thing, and I'm going to tell you it's almost simultaneous how they affect each other, is not only do we have stress with the nervous system, but our gastrointestinal system, which, by the way, is connected, Lynn, by the brain-gut connection through a nerve called the vagus nerve. It all gets affected. That's why the universal symbol for stress is not this, it's hand here and a hand on the stomach. And so, yeah, that's really it right there, for sure.
Yeah, and you mentioned a lot of the kind of symptomatology that we can expect from running a gamut of stress for most of us our entire lives. But some of us have more stress than others, right? Mm-hmm. Yeah. And coping mechanisms can be different too for different people, right? Some people deal with stress a lot more differently than others as well. And that's probably why we don't have 100%, but we have a huge percentage of people that cannot handle it very well. So how do you think diet influences gut issues?
Well, diet is everything when it comes to health in general, but especially the gut. I mean, what you just said a second ago was about stress and how we all adapt to stress differently. That's really the thing that we need to think about, because to be a healthy human, you have to be able to adapt. If you cannot adapt to stresses, your body perishes, you die. And so we could there could be 100 people in the room right now, and all of us have the same stress under our body. And that stress affects all of us differently. And that stress could cause you to have irritable bowel syndrome, me to get headaches, that person to have neck pain, this person here to have knee problems. Stress causes that imbalance in the gut bacteria, because when our hormones get out of balance, when cortisol levels go up, that's the stress hormone. What happens is the bad bacteria in the body tends to go up as well. You see, we have good and bad bacteria. And we have to have enough good, healthy bacteria in the body to live. The problem is most of us don't have enough good bacteria. We don't feed that bacteria. Mm-hmm. And so, when we get stressed out and we don't eat a good, healthy diet, and we don't get the primary nutrient that we need, also known as a probiotic, which is fiber. You see, fiber, Lynn, mixes with good, healthy bacteria in the body. That fiber then makes that with the good bacteria, it ferments and it turns into something called the short chain fatty acid. And a short chain fatty acid is one of the most important healing compounds and chemicals that the body produces, that is very difficult to get through food and nutrition, that most people have never heard about. And it's one of the quintessential chemicals in the body to allow the body to truly heal. And so if you look at like if you look at folks that eat a standard American diet
Mhm.
or the Western diet, 95% of those individuals are deficient in fiber. Well,
Mhm.
they don't have enough fiber. So that right there tells me that they can never make enough short chain fatty acids. And the short chain fatty acids are the nutrient that the body needs to heal inflammation, to heal, to get the mitochondria, the nutrients it needs to make energy in the body, to reduce inflammation. You know, and when we don't have that short chain fatty acids, our body gets sick. We get so out of balance. And you could take all the good, healthy bacteria. I'm a big fan of eating fermented foods. I'm a big fan of probiotics. But if you don't have the prebiotics that feeds that stuff, you know, you said at the beginning of this interview, I'm an old farm kid, right? I grew up on a farm in central Illinois. And when we would plant the corn and the beans and the wheat every year, we would have to make sure that field has fertilizer on it, that it's got the nutrients it needs, so that when we plant those seeds in there, that it works. You can take all the probiotics on the planet, but if you don't have enough good prebiotics and postbiotics, the body can't be healthy, and diet is the key to that whole thing.
Absolutely. I 100% agree with that, because a lot of people are taking the probiotics, but not the prebiotics as well.
Yeah.
So it's good information. So we have all these people walking around with all these gut issues. A lot of them are taking a lot of medications, and then the medications create a lot of side effects. Is there a more natural approach to being able to help them heal this inflammation in the lining of their gut?
There absolutely is. But you know, one of the things I want to say before we get into to the solution is, a
Sure.
lot of people don't realize that their symptoms that they have are caused by leaky gut, dysbiosis, dysbacteriosis, you name it. I mean, you know, I'm in private practice and I see hundreds of patients every week, and not a day goes by that someone comes in, let's say with, you know, heart issues or high blood pressure or pain or whatever. And I say, well, your problem's not in your shoulder. Your problem is in your GI tract. After we run some tests and we see what's going on, they say, oh, Dr. Eric,
Yeah.
I thought you were smarter than that. My pain's here. My stomach's fine. I have a bowel movement every day. Well, that's the problem. See, we really don't know what health is. Like, most people don't really know what health is. We don't understand that when we get out of balance with the gut bacteria, that then causes inflammation. That then causes our body not to be able to heal. So the healing mechanisms, the repair process of our body is all predicated off of our GI function. And if that doesn't work, what happens is our gut has, well, it gets these little holes in it, and it leaks toxins out of it. The large and small intestine, primarily the small intestine, and those little toxins that leak out are known as endokins. And those little toxic endokins, wherever they settle in the body, is going to cause a problem. If they settle in your muscles, you're going to have fibromyalgia type pain. If they settle in your joints, you're going to get joint pain or arthritic changes in there, even if you weren't an athlete. And you're like, man, the doctor says, well, were you a baseball player? Did you run all the time? No, but the gut could cause that. And because of the fact that the GI tract is where some 80+% of your neurotransmitters are made, Lynn, this is a big deal. So things like anxiety, depression, insomnia, and fatigue can all be symptomatology based off of GI imbalances. And last but not least, with the GI tract, the immune system. You see, we now live in a world where people are so concerned, and I think it's great that we are concerned about immune system function. I think it's amazing that we have those concerns. But we need to understand that 80 to 85% of our immune system is made in our gut-associated lymphatic tissue in the GI tract. So if you don't have a healthy gut, your body can't heal, your immune system can't work, you're going to have pain, inflammation, so on and so forth. So that's why it goes back to Hippocrates' whole idea of first fix the gut and everything follows suit. One of the simple things that people can start doing right now, if they would just right now start adding to their diet good, healthy fiber. You know, when I say the word fiber, I think a lot of people in America think it's a 4-letter word, and it's not. Fiber is not a 4-letter word. It's a good thing. We need to get fiber. Vegetables, dark leafy green vegetables. You know, I grew up on a farm, and we ate protein all the time. You know, we had bacon for lunch, pork chops for dinner, and everything else, meat in between. We didn't eat a lot of vegetables, and I wondered why everybody around me was in pain all the time and had high blood pressure and inflammation and their joints hurt. It's because they weren't getting enough fiber in their diet. And so if you'll just right now start adding some dark leafy green vegetables, you see the average person needs about 4 to 6 cups a day of dark green vegetables just to get enough fiber and potassium in their diet to keep their muscles going, their heart going, their brain and their body going. Most people don't get anywhere near that. So if you start adding that, that'll help so much. Okay. That's number one. Number two, if we'll start getting some good, healthy bacteria. Now, I'm not opposed to probiotics. I think some probiotics are great, but I love fermented foods. Sauerkraut is one of my favorite things to eat and one of my favorite things to prescribe to my patients. Sometimes I get a funny look when I say, eat more sauerkraut or eat more fermented vegetables, but it's a great way to get that good, healthy bacteria. And remember what I said, we have to have fiber and good bacteria to mix together to make that short chain fatty acids. Now, if somebody does not like to eat those foods, and I get it, a lot of people have their mindset around not doing it. That doesn't mean the body still doesn't need it, Lynn. So we supplement. Like, I'm a huge fan of using fiber to fix the gut, nucleotides to fix the gut. And I love using things like butyric acid, and the form that I like is called tributyrin, because most butyric acid, I don't know if you know much about butyric acid, but butyric acid is used to heal the lining of the gut. Butyric acid helps make short chain fatty acids. So it heals those little holes that get embedded into the gut that cause leaky gut syndrome, if you will. And most people don't get enough fiber, nor do they eat enough good fats to have that. And I like using tributyrin because butyric acid, if we eat it, normally gets absorbed in the stomach and broken down there, where tributyrin gets broken down in the large intestine. So if you want to know, like, what are my go-to to fix the gut? First of all, you got to clean up the diet. Just stay away from the fried food, the processed food, all the things that, taste so great to most people. We got to get that out of the system. Add the fiber, add nucleotides, because nucleotides are the basic fundamental building block of DNA and RNA in the body that mixes with protein to heal the tissues. Add some fermented foods. That's not hard to do. Sauerkraut's one of the easiest things you can add. Add some short chain fatty acids and drink some water. If you'll put those things into play consistently within 90 days, you'll look and feel like a different person. I promise.
Yeah. Wow. I think, people watching this are going, wow, that's such a simple answer. And it's surprising, though, how difficult it is for some people to actually get into action and get it done. Right. And, the results are amazing if you can just do it. I know when I was critically ill years ago, I fought for 2 years to save my life, and diet was number one. Like, I mean, nothing went into me that wasn't organic or healthy or hormone free. And I got to live. So it's, I think it's really important that people are listening to you. So now you have some products that you recommend, and,
okay,
this isn't about selling the products, but this is about getting information out to people that need this information, right? Because I know for me, I battled for many years with stomach disorders and did everything wrong, right? I mean, I did the ranitidine and all those kinds of things. And I don't mean that it's totally bad. There are times that you just have to do some of those things, although, don't let it get that bad, right?
Yeah.
Excuse me, falling off my chair here. But I think it's really important too that they understand that the benefits from this outweigh the side effects that they can get from doing it in other ways, right? This is no side effects using this plan that you're suggesting, right?
Well, let me talk a little bit about this. You have to understand. Yeah. So, I have multiple offices, right? My offices every year are responsible for 400,000 to 500,000 office visits, depending upon the year, with all of us. We see a lot of patients. And so I'm used to working with a lot of people. And so I know at the end of the day, if we lived in an ideal world, and if my patients, your patients came to you and did what we told them to do, they would just get better, right? They would just get better. But the reality of it is that that's not always the case. And changing the diet, because if someone's eaten a certain way for 20, 30, 40, 50 years, they're pretty programmed to do that. And unless they have a remarkable reason why, or are really inspired enough to make a change, them changing their diet's probably not going to be the solution. So I had to figure out, okay, what can I do to supplement a bad lifestyle? Because that's all supplements are. You should not be living off of your supplements. Let me say that again. You should not be living off of your supplements. You should eat a diet that is good and healthy for your stress and your needs. And whatever you don't consume into your daily routine, you need to supplement that. That's where the term supplement came from, right? So what we found is, if I can add, and I'm telling you, 95% of people are deficient in fiber. And then you got some 80+%. I think it's more, but the research says 80+% of people that have low or abnormal, good, healthy bacteria in the gut. So they're not making short chain fatty acids. Those three right there are the triad for helping heal the gut and then ultimately heal the body. So what did we do? We put a couple products together. We put some fiber and some nucleotides into a product. We call that product Happy Tides. That's the name of it. They're all the nucleotides, which, if you remember nucleotides, anybody that remembers DNA sequencing, those letters, those are nucleotides. So what a nucleotide does is it grabs protein, and it's a signaling mechanism, and it says, hey, protein, I need you to turn into this type of tissue and go heal that gut, or go heal that muscle or that bone or that nerve. That's what nucleotides do. And so we put fiber and nucleotides together in that formula so that we could get people the fiber and the nucleotides that they needed. And what I tell people, Lynn, I like to use analogies. And I tell people that your lining of your intestines is a lot like the drywall of your hallway, right? And so if somebody walked down the hallway and started punching holes in the drywall, you need to fix those holes, right? Number one, but you're not going to replace the whole wall. You need to put something, we call it drywall spackle. That's what we call it in America. Okay. So nucleotides mixed with fiber is that spackle. It helps patch those holes up. Well, then, because we know, and by the way, nucleotides and acai gum, which is the fiber that we use, that fiber is actually the fiber that is clinically and clinically proven to improve good, healthy bacterial function. So it helps you make your own healthy bacteria better. So we mix those together. We give those to our patients. We encourage them highly to eat more fiber, eat some fermented foods. It's not difficult to do that. If they don't do fermented foods, have a probiotic. But then we use another nutritional product. That's the actual product is called Biome IX with vitamin A, D, and K in it. But what's in it is a nutrient called butyric acid or butyrate in the form of tributyrin. Tributyrin is 3 butyric acids attached to a carbon molecule that allows that butyrate, which heals the body, which is anti-aging, anti-inflammation, anti-carcinogen as well, because it has chemotactic properties, all the things that we need to heal. It drives that down into the small, large intestine where absorption of that is. So if we know that most people don't eat enough fiber, don't get enough good bacteria, and don't have short chain fatty acids, the Happy Tides product plus the Biome IX together facilitates all three of those needs, if that makes sense. Because honestly, Lynn, you can tell I don't have any hair left on my head. I got tired of pulling it all out because I'm seeing all these patients with chronic fatigue, chronic pain, autoimmune syndromes, high blood pressure, all this stuff that we've known has been dietary and lifestyle related. We've known this for decades, forever. We've known this. But I would say all you have to do is change your lifestyle, and they wouldn't do it. But if I give them some supplements and then they start feeling better, usually people start feeling better within the first week to 2 weeks of doing this, some even sooner. And then it's just interesting to me, and I know you've experienced this with your patients, when people start feeling better, they start saying, hey, I think I want to go for a walk. Or, hey, I think I want to start eating better. Or maybe I'm craving some more water. It's funny how when you start moving towards health, your body starts shifting that way. And then you break up those old patterns that you've had for however many years or decades. And now you're eating well and moving a little bit and exercising and getting fermented foods. And next thing you know, you're out of sickness and moving towards, back towards ease and towards health. So I don't know if that makes sense, but that's what I recommend for my patients. And it works. It works.
Makes absolute sense. And just so you know that we're in Canada, we can't get a couple of those products yet, I believe. I know we can get one, and we're going to have it available through our clinic.
Yeah.
So people in Canada can reach out to us. If you're in the States, we can definitely get it to you in the States. So, if you want info, just put info in the comments below or private message us, at a different kind of better.com, or email us at a different kind of better@gmail.com if you want more information on what Dr. Eric is talking about today. So I liked how you said that they start seeing results fairly soon. And so how long have you been using this triad combination?
Well, I've been using nucleotides and butyric acid in my practice for over 15 years. I've just never had, how do I say this as straightforward as I can, precise and quality products to do it with. You have to understand, most people, if they want to get this level of butyrate in their system, they need to be eating so many vegetables, and they need to be eating, healthy ghee butters and things like that. People don't do that. They don't get enough of that. Right. So the triad I've been using in my practice now, this specific triad, for almost 18 months. I think maybe a little bit longer, on, again, tens of thousands of people. I mean, this is not just a few, this is a lot of people. And so typically, here's what we see results with first and the fastest. Number one, any type of heartburn, indigestion, reflux, those kind of things, we see those clear up relatively quickly. Why? Because it's going to reduce inflammation. It's going to get the nucleotides, and all the fiber that's in there is going to obviously help make the short chain fatty acids. The BioMyX, which is in my opinion, it's the most powerful product in my arsenal of tools that we use. That one is the short chain fatty acids that helps with repair. So we see that very quickly. The second thing that I see reduce quick is pain. So, and this is the kind of pain that I see go away. Systemic pain. These are people that have, one day, Lynn, they'll wake up and their right shoulder will hurt. Next day, it's the elbow. Then it's the hip. Then it's the knee. It moves all over the place, right? It's not a specific injury in an area. It's where the inflammation settles for that day. And because of the fact that there's holes in the gut, literally the gut leaks those toxins out. And if we can get those toxins, number one, to get the inflammation down, so the butyric acid does that, and we can fix the holes in the gut, it doesn't leak back out there again. And I'll tell you, I just had a woman, this is such a cool story. I'm just going to tell you this. I hope it's okay.
I was going to ask you for one.
Okay, great. There's a woman of mine, patient of mine, one of my favorite people. I tell you, I have a lot of amazing people in my life. And this one lady, her name is Fong, and she's given me permission to talk about her. I talk about her a lot. And she's had fibromyalgia, autoimmune issues, chronic fatigue. I mean, the whole triad of problems for almost 3 decades. She's gone to the Mayo Clinic, tried every drug you could do. When that failed her, she changed her whole lifestyle, started eating clean, eating natural, got a little bit better, but just couldn't get over that hump to get herself where she wants to be. Right. I put her on the triad, and 3 days into it, that's how bad her gut was. What I find is the worse someone is, the faster they're going to find symptom relief, if that makes sense, right? Mm-hmm. Because these people don't really know what it feels like to feel good. They just don't. And within 3 days, she called me and came to my office, and my office manager said, "Hey, Fong is in room 3. I don't know what's going on, but she's crying. She needs to talk to you." And I'm like, "Okay, let's go and see what's going on." She's not crying because she's hurting. She's crying because her pain is in her hands. And guess what she does for a living? She does sign language work. Oh. And her whole life was about being able to use her hands. And she was getting to the point, she's only in her 40s, where she was unable to be able to do that kind of work. And she's like, "Dr. Eric, my hands, no swelling anymore. My dexterity is improving. This is too good to be true." And that's what's happening with her. Now, she's changed her diet, changed her lifestyle, done a lot of things to get to that point. And that was really the formula that helped push her over the top to get that healing, which is a really cool, really cool. I'll tell you another one. This just happened yesterday. And you got to shut me up because I get excited about patient stories.
I'm not gonna do that.
So check this out. I have a 3-month-old baby that I see in my practice, and this 3-month-old was born C-section. And when a child is born C-section, they don't go down the vaginal canal. They don't get a lot of things, but they don't get the normal bacteria that coming out of the vaginal canal in their mouth. So they don't have good biosis, good bacteria. This child was having failure to thrive, so wasn't keeping food down at all. Just was in a constant hiccup, like all the time. She's 3 months old, right? And through the work with her pediatrician, with the nutritional stuff we did, We put a formula together for her using tributyrin and nucleotides, put it in her formula every day. Within, this is awesome. Within 3 days, the reflex and vomiting stopped. So now every time she eats, she's able to keep it in her. Now she can keep the food in her, and she's starting to grow. She's starting to make eye contact already. Her parents were ecstatic. I just got the report, I think it was yesterday on this. And what a blessing to be able to help people. And so simple, right? So simple. Right. But the key is we took this quote unquote complex thing, which is eating fiber. Apparently that's hard for some folks, but eating fiber, putting nucleotides with it, using butyric acid to make short chain fatty acids, giving the body the stuff it needs in a formula and a delivery system that is easy to do it, and it works. So, I mean, I could go on and on and on about testimonials, but it's just fun. That's what I love. You know, I love communicating to people like you, but I love seeing people get better. That's why I was put on this planet for.
Yeah, well, there are a ton of us that just want to help people, but sometimes it's pretty hard to get the word out. So we're going to ask the viewers that are here today. First of all, if you have any questions for Dr. Eric, please make sure you send them to me. I'll make sure that he sees them and gets them, and get back to you with some advice if you need it. And I hope that's okay for me to do that. Is that okay?
Yeah.
And secondly, share this information. We are just two people, but there's a whole ton of people out there that are going to be watching this now or later or in the future. And you can help people just by sharing. You can be part of this vision to help as many people feel and have a better quality of life. So do you have anything else that you want to just leave us with?
Lynn, I would just say this, is I would say that if you're watching this right now, there's no mistake. You're here for a reason. And by the way, that reason may not be for you personally. That may be because you have a friend, a family member, a coworker, a loved one, someone in your life that has a problem. I mean, listen, anyone over the age of 25, if you have friends or family, after the first 5 minutes of talking to them, seeing them, they're going to be telling you about their health challenges. And if you had an opportunity to help somebody, man, this would be a great opportunity for you. So I would just encourage people to get educated. I love your platform, Lynn, that you guys have, because it's all about education. Without knowledge, people perish. But the thing is, you got to take that knowledge and apply it to your life. Applied knowledge is called wisdom. And I'm just going to encourage everyone that's watching right now, you know, I don't care what sickness, disease, symptoms, problems you've got, where your health is, there are always things that can be done to improve upon that. I'm not saying you can cure everything, but you can improve upon your health. And getting with Lynn and her team and the doctors there and the folks that are doing the work with the gut health and everything else they do, that would be a great place to start. And Lynn, just like you said, anything that we can do to help anyone, we're here to do it. And last thing I'll say is, everyone that's watching now, hit that share button, tag some friends, go back and do a watch party later if you're on social media, because every one of us is an author and a publisher. You know, you may have 5 or 10 or 20 or 50 or 1,000 friends on social media that could benefit from this, and you never know until they see this and hear this. So I just would encourage people to share this stuff, Lynn, because I've seen so many lives changed by getting to the root cause of people's problems that they didn't even know was possible. And my most fulfilling thing in life is when I see that light go off in somebody's eyes and go, oh, that makes sense. So hopefully the communication that you and I have had together about gut health, about what's going on, can give at least one person that spark to change their life. And that person can change the life of another and another and another. And next thing you know, we're doing a lot better because we're doing this together. So I just would like to say that to everybody.
Well, once again, I cannot tell you how honored I am to have you come in and help our viewers. And we are so grateful. You know, God bless you for doing the work that you do. And I hope we can get you back some other time, maybe to talk about another topic.
I'm happy to do that. Anytime, just let me know. Thank you so much. Thank you for the work that you're doing. We're all in this together, and I'm happy to serve.
All right.
Thank you.
You take care. And so everybody, thanks for joining in today. Thank you for the people that will be watching it in the future. Please make sure you tune in. Go like our page and follow us on A Different Kind of Better on Facebook. And we hope to meet you soon. Take care, everybody. Have a great day. Thanks. Bye-bye.